Evaluation and Management Part 2. Levels of EM services. Select the appropriate level of EM services based on the following. 1. The level of the MDM is defined for each service, or
2. The total time for EM services performed on the date of the encounter. Within each category or subcategory of EM service based on MDM or time, there are 3 to 5 levels of EM services available for reporting purposes. Levels of EM services are not interchangeable among the different categories or subcategories of service. For example, the first level of EM services in the subcategory of office visit, new patient, does not have the same
definition as the first level of EM services in the subcategory of office visit, established patient. Each level of EM services may be used by all physicians or other qualified healthcare professionals. Guidelines for selecting level of service based on medical decision making.
4 types of MDM are recognized: straightforward, low, moderate, and high. The concept of
the level of MDM does not apply to 99,211, 99,281. MDM includes establishing diagnoses, assessing the status of a condition, and/or selecting a management option. MDM is defined by 3 elements. The elements are the
number and complexity of problems that are addressed during the encounter, the amount and/or complexity of data to be reviewed and analyzed. These data include
medical records, tests, and/or other information that must be obtained, ordered, reviewed, and analyzed for the encounter. This includes information obtained from multiple sources or interprofessional communications that are not reported separately and interpretation of tests that are not reported separately. Ordering a test is included in the category of test results, and the review of the test result is part of the encounter and not a subsequent encounter. Ordering a test may include those considered but not selected after shared
decision-making. For example, a patient may request diagnostic imaging that is not necessary for their condition, and discussion of the lack of benefit may be required. Alternatively, a test may normally be performed, but due to the risk for a specific patient it
is not ordered. These considerations must be documented. Data are divided into 3 categories: filled circle tests, documents, orders, or independent historians. Each unique test, order, or document is counted to meet a threshold number. Filled circle independent interpretation of tests not separately reported. Filled circle discussion of management or test interpretation with external physician or other qualified healthcare professional or appropriate source not separately reported. The risk of complications and/or morbidity or mortality of patient management. This includes decisions made at the encounter associated with diagnostic procedures and treatments. This includes the possible management options selected and those considered
but not selected after shared decision-making with the patient and/or family. For example, a decision about hospitalization includes consideration of alternative levels of care. Examples may include a psychiatric patient with a sufficient degree of support in the outpatient setting, or the decision to not hospitalize a patient with advanced dementia with an acute condition that would generally warrant inpatient care, but for whom the goal is palliative treatment. Shared decision-making involves eliciting patient and/or family preferences, patient and/or family education, and explaining risks and benefits of management options. MDM may be impacted by role and management responsibility. When the physician or other qualified healthcare professional is reporting a separate CPT code that includes interpretation and/or report, the interpretation and/or report is not counted toward the MDM when selecting a level of EM services. When the physician or other qualified healthcare professional is reporting a separate service for discussion of management with a physician or another qualified healthcare professional, the discussion is not counted toward the MDM when selecting a level of EM services. The levels of medical decision-making, MDM, Table 1, is a guide to assist in selecting the level of MDM for reporting an EM services code. The table includes the 4 levels of MDM, i.e., straightforward, low, moderate, high, and the 3 elements of MDM, i.e., number and complexity of problems addressed at the encounter, amount and/or complexity of data reviewed and analyzed, and risk of complications and/or morbidity or mortality of patient management. To qualify for a particular level of MDM, 2 of the 3 elements for that level of MDM must be met or exceeded. Examples in the table may be more or less applicable to specific settings of care. For example, The decision to hospitalize applies to the outpatient or nursing facility encounters, whereas the decision to escalate hospital level of care, e.g., transfer to ICU, applies to the hospitalized or observation care patient. See also the introductory guidelines of each code family section. Table 1. Levels of medical decision-making, MDM. Elements of medical decision-making level of MDM, based on 2 out of 3 elements of MDM. Number and complexity of problems addressed at the encounter, amount and/or complexity of data to be reviewed and analyzed. Each unique test, order, or document contributes to the combination of 2 or combination of 3 in Category 1 below. Risk of complications and/or morbidity or mortality of patient management.